IgA nephropathy, or IgAN, is an autoimmune disease that can cause progressive kidney failure. Patients are often diagnosed in their 20s and 30s, with up to 50% progressing to end-stage renal disease, requiring dialysis or transplantation. The onset of IgAN is believed to be caused by a combination of genetic and environmental factors. The source of the autoimmunity is production of galactose-deficient IgA1, Gd-IgA1, from abnormal B-cell priming, which occurs in the body's mucosal surfaces. B lymphocyte stimulator, or BLyS, and A proliferation-inducing ligand, or APRIL, are key factors controlling B-cell differentiation. Both cytokines bind to receptors on B cells or plasma cells. BLyS promotes B cell maturation and survival, whereas APRIL promotes plasma cell survival and increases antibody class switching. Both are elevated in IgAN patients and promote the overproduction of Gd-IgA1. Gd-IgA1 antibodies are an abnormal form of IgA1 that are recognized as foreign by IgAN patients. As a result, autoantibodies targeting a particular region of Gd-IgA1 are produced by B cells and plasma cells, causing the formation of immune complexes. These deposit in the kidneys, leading to an inflammatory cascade, which over time leads to progressive kidney damage, evidenced by proteinuria and decreased glomerular filtration rate. Current approaches to treating IgAN either take a nonspecific approach using corticosteroids or act downstream in the disease pathway. None have shown the ability to meaningfully reduce Gd-IgA1, the upstream source of immune complex formation. What if a drug could prevent Gd-IgA1 formation and reduce the risk of progressive kidney failure, and potentially avoid the need for dialysis or transplantation? Atacicept, Vera's lead product candidate, may have this potential. Atacicept is a fully humanized fusion protein that combines part of the TACI receptor with the Fc domain of IgG1. Atacicept binds to both BLyS and APRIL, blocking their action on B cells and plasma cells. It therefore interferes with several upstream pathways that cause IgAN. Through dual inhibition of BLyS and APRIL, Atacicept reduces the number of plasma cells and antibody class switching to IgA, therefore reducing the production of Gd-IgA1. This in turn may reduce the production of autoantibodies against Gd-IgA1, lowering immune complex formation. With less immune complex deposition in the kidneys, inflammation of the kidney would also be reduced. Ultimately, the number of patients with progressive renal injury would be reduced, significantly lowering the morbidity and mortality associated with IgAN. Atacicept represents a novel potential approach to IgAN treatment. Atacicept is the first molecule to substantially reduce Gd-IgA1 in a clinical trial of IgAN patients. Atacicept has a well-characterized clinical safety profile, and by targeting the upstream source of the disease, treatment with Atacicept has the potential to improve kidney function, preventing the decline that leads to dialysis and transplantation. Target the source of the disease, enable new possibilities for patients.